we're doing the one where he has rolled his ankle, his left ankle. So first I would check the scene, and I'd be wearing the correct equipment. I'd check the scene for sight, smell, and then wear gloves or an apron if there's any bodily fluids included. First I'm gonna look for any signs or symptoms of his left ankle, see if there's any crepitus, and also feel the area, and ask if there's any pain or guarding and loss of function. And then also, I already took a history, and the patient did fall on the curb. And then I'll ask if there's any pain with this or any motion of it. And then I'd feel for a pulse on the medial malleolus, the tibial nerve, if the patient's not too bad in pain. Okay. And I'm gonna have you close your eyes. I'm gonna squeeze one of the toes and ask if you differentiate what toe it is. So I'll close your eyes.
Third. First. Fifth.
Good. And then I'll have you wiggle your toes. Good. And then, alright, then I'll start with the splint of his foot. So I'll wrap this around here. And grab this. So I'll hold that for a second. And I'm gonna start wrapping this. Oops. Around the patient. Tie this again. I would normally just knot it, but I kind of want to get the knot out, so I'm not going to do that. And then we'll wrap this around the other foot right here. In order to stabilize that second joint, rule of thirds. Don't forget. Okay. And after I am done wrapping his ankle, I'm going to go back and check the pulse and make sure it's still there. And then I move his foot. Squeeze. Okay. We were palpating. It was around the lateral malleolus. The patient had pain after tripping and rolling their ankle. So the diagnosis for our patient today would be a lateral malleolus fracture. And then after we have splinted the patient, we'll have him, I'm going to be doing another sensation check to make sure CMS is still intact. So I'm going to have my patient close their eyes again, and I'm going to be squeezing your toes. So let me know which one I'm squeezing.
Second. First. Fourth.
Bringing my patient to immediate care and ER, and I will be telling them to be applying ice for 20 minutes, 3 to 4 times during that 24-hour period. All right, for this scenario, our patient is collapsed on the floor, having a history of seizures. First, we're going to be inspecting the area, listening, smelling, make sure that the area is safe. Next up, we will be having the correct equipment, such as gloves, a gown, to make sure there's no bodily substances getting on us that will cause harm. After that, what to look for in our patient is to know if they had a sudden fall to the floor, looking at their arms, see if there's stiffening, followed by jerky movements. Looking at their mouth to see if there's any foaming, grinding of the teeth. Looking at their face and lips to see if it's blue or gray appearance. And then also looking at their eyes to see if they've been rolling upwards. And then we also want to look to see if they had any loss of bladder function or bowel controls. After that, we're going to move all the area, move these things in the area to make sure it's all clear. That's good. And then we will be placing something soft underneath their head in order to protect their head area. And placing a pillow on it. And then we will be timing the start of the seizure until the end of the seizure, and along with keeping bystanders away from the patient in order to prevent others from getting harmed, along with our patient here. Then we'll be calling 911 if the seizure has lasted longer than 5 minutes. If there's a series of seizures, if the patient is having difficulty breathing after the seizure, other signs or conditions that they'd have, such as if they're pregnant or if they have diabetes. If the seizure happened in water, which is not this case, but. And then also if this is their first seizure, if it's an injury-related seizure, and if they have a slow recovery time. Then after the seizure, we will make sure to keep our patient's airway open, and then we will be placing our patient on their side. As of right now, I won't step out now. Is there a problem there? And then we'll be monitoring their breathing, and if they stop breathing, we'll begin CPR. And then we'll also be allowing our patient to sleep, and then we'll stay with them until they are fully recovered. After that, we'll be referring them to a neurologist in order to have more testing done and proper care. You.